This is Elianna, and she is my patient. Without our help, she will most likely die before she's born. I came to UCSF because fetal surgery was born right here. And I love being able to look at parents in the eye and say, we know what's going on with your child. We think we know how to fix it. There are also a lot of patients that we don't quite know how to help. What we're trying to do now is to bring fetal surgery to the next frontier. If this works, we would be able to treat fetuses with a whole range of blood disorders before birth. This is the world's first clinical trial of a fetal stem cell therapy. One of the main things we've discovered is that there are cells trafficking between the mother and the fetus. If you transplant cells from the mother, the fetus will tolerate them, and the transplant should be more successful. Elianna's parents were the most lovely, caring, generous couple we could have had for our first patient. And they asked me, Dr. MacKenzie, have you done this before? And I said, no, you would be the first. I can't think of a situation where you have more of a sense of responsibility. The day of the surgery was an incredibly surreal day where I tried very hard not to think of the fact that this day would be the culmination of more than a decade of research. The first step in this process is to harvest the bone marrow stem cells from the mother. Then, the stem cells are taken to the bone marrow processing lab where they're isolated and purified. We then inject the mother's healthy stem cells into the umbilical vein of the fetus, along with a blood transfusion. Then, we wait to see if the transplant works. Elianna is the first patient in our clinical trial to receive stem cells prior to birth. It was an amazing feeling to see Elianna wiggling around the incubator bed with her full head of black hair. This trial is the first step on a long journey. One thing that keeps me going is that we're so close. We're right there. We're almost able to treat fetuses and families with a whole host of birth defects. We're going to continue this work until birth defects are a thing of the past.